Good morning, everyone. Thank you for joining us today to discuss Medicare coverage and billing for diabetes services. My name is Karen Curtis, and I am a provider outreach and education specialist here at WPS. Today, I am joined by my friend and coworker, Leanne Foster. Leanne is going to help me out today by monitoring the chat for questions that you may have and providing some additional information during the presentation. Now, the last time I held a webinar on diabetes was back in 2023, and since some changes were made last year, I thought it would be a good time to put it back in the preventive services rotation. I have just a couple of things to cover before we get started. The Training Center webpage is where you can find information related to the Provider Outreach and Education team. A copy of today's slide presentation is available for download on the live events page. There you can find upcoming education, links to register for those webinars, and in the column titled Materials, that's where you're going to find a link to the PowerPoint slides that we show during our events. The Training Center is also home to our Encore Presentations webpage. All of our webinars are recorded, and if there are no technical difficulties, the videos will be posted to our Encore Presentations page, along with our YouTube channel. Videos are available for up to 90 days, and they can be watched on our webpage without you having to go to YouTube. We know that some of you may not be able to access YouTube from your company computers, and we want you to be able to receive the education that you're interested in. After 90 days, the videos will be removed, but they will remain on our YouTube channel until the webinar is redone or the information changes. Later, there will be a question and answer session if time permits. If you have any questions related to today's topic, please send those using the chat feature. I did receive some pre-submitted questions, which I will answer at that time. Now, if there are any questions that I don't get to, or if some require additional research, an email providing those answers will be sent to everyone in attendance. Our goal is to provide you with an excellent customer experience. We want to know how we're doing, so later in the presentation, you will be given the opportunity to provide feedback on today's event. This is your chance to let us know what you feel that we are doing right. Let us know if there's areas where you think that we can improve. It also gives you the opportunity to provide input on what types of education you would like to see in the future. While this is a CMS survey, WPS does look at our results, and we do our best to make the improvements that you ask for. Here at WPS, we do our best to provide you with accurate, up-to-date education. If you've worked in Medicare for a while, you know that Medicare rules and regulations can change. So for this reason, the CMS website should be checked for updates, and the federal regulations will take priority over anything presented today. Questions are answered based on the facts given, so any changes to that information may change the response given. We also are not able to guarantee payment for services. If you do have a claim, and they can provide you with an answer based on how your claim processed. Lastly, I need to let you know that CMS does prohibit the recording of this webinar. We are recording the event so it can be posted as an encore. This recording should be available next week if you'd like to review or share any of the material being presented today. This is the American Medical Association's copyright notice for CPT codes. During this presentation, I will provide billing information, which does contain CPT codes. So this notice just lets you know that Medicare does not own CPT codes or their descriptions. And I promise this is the last copyright notice. This one is from the American Hospital Association National Uniform Billing Committee. This notice is required since I discuss coding that would be included on a UBO 4 or 837I. The American Hospital Association is not responsible for, nor were they involved in the preparation of any of this material or information that's being provided today. Okay, so topics that will be discussed today. I am going to give some general information and background regarding diabetes. I'll go through the different services that are covered for diabetes and how to bill for those services. And finally, we're going to discuss how to check eligibility, and I'll provide you with some resources that'll give you some additional information on certain services. Now, the world of Medicare contains a lot of acronyms. I've created a list of those that you will either see or hear during my presentation. Many of you may be aware of most, if not all of these. I like to include them just in case we have someone who's new to Medicare, or maybe someone who doesn't work in a field or practice where they've had to know what all of these mean. So if I do mention an acronym that you're not familiar with, you'll have these slides for reference. So we'll start out with a little general information about diabetes. I wanted to throw in some statistics so we can see how big of an issue diabetes really is. Unfortunately, out of the millions of people who have diabetes, 1 in 5 don't know that they have it. Over a third of those with pre-diabetes are unaware of their condition. Although diabetes is listed as the 8th leading cause of death in the U.S., the Center for Disease Control believes that this may be underreported. $372 billion is lost yearly in medical costs, lost work, and wages. Over time, high blood glucose levels can damage blood vessels and organs within the body, leading to other health complications. So what are these complications? Heart disease is the leading cause of death for people living with diabetes. Studies have also found that nerve damage affects about half of all people diagnosed with diabetes. Those that can manage their blood sugar levels have a better chance of managing or preventing this condition. Nerve damage alone can lead to many of the other complications listed here, such as foot and oral health, along with the loss of hearing and vision. Mental health is important regardless of age, but as we get older, there may be some life experiences that people may have a harder time recovering from. A condition known as diabetes distress can occur when individuals get worried, frustrated, or just tired of dealing with daily diabetes care. You may find that patients need to be referred to mental health counselors for additional help. So the services that I'd like to about today are going to include diabetes screening, diabetes self-management training, medical nutrition therapy, and the Medicare Diabetes Prevention Program. We're going to start out with diabetes screening. These tests can help detect prediabetes or diabetes in individuals before they begin to show symptoms. This allows for intervention, which can prevent the onset of type 2 diabetes or minimize the risk of complications associated with diabetes. Testing is covered under Medicare Part B for patients who have any of the risk factors listed on this slide. This is also covered if the beneficiary meets 2 or more of the conditions of being 65 or older, overweight, a family history of diabetes, or a history of gestational diabetes. Patients previously diagnosed with diabetes are not eligible. There is no cost to the beneficiary if the provider accepts assignment. Now, last year, some changes were made to the frequency coverage. Prior to January 1st of 2024, patients who had been tested previously but were not diagnosed as pre-diabetic, or for patients who were never tested, this test is covered or the test was covered once every 12 months. For patients that have been diagnosed as pre-diabetic, the test is covered once every 6 months. So now, as of January 1st of 2024, Medicare no longer distinguishes frequency based on prior diagnosis of prediabetes. So the current guidelines allow for 2 tests every 12 months following the date of the initial screening. So when we look at all the codes used to bill for diabetes screening, another change that came in 2024 was the addition of code 83036, which is for A1C. Previously, this code was covered for the purposes of diabetes management, but it wasn't included in the screening tests. So that's a new addition. Services should be billed with diagnosis code Z13.1. I have also found some places that still mention modifier TS. This modifier was used when tests were performed every 6 months due to the patient being diagnosed as pre-diabetic. But since CMS has changed their frequency limitations, that modifier TS no longer applies to diabetic screening services. Diabetes self-management training teaches patients to manage their diabetes. The program includes instructions on how to self-monitor blood glucose levels, education on diet and exercise, and insulin treatment plan developed specifically for the patient who is insulin dependent, and motivation for patients to use the skills for self-management. These services are covered under Part B for beneficiaries who have been diagnosed with diabetes. After evaluating the patient, the treating physician or qualified practitioner would need to order the training. A plan of care must be maintained in the beneficiary's medical record. The order must include a signed statement that the services are needed, as well as the number of initial or follow-up hours ordered, topics to be discovered in training, and a determination that the beneficiary should receive individual or group training. If for any reason the training is changed, the order or the referral must be signed by the physician or qualified non-physician practitioner and kept in the beneficiary's file. Deductible and coinsurance do apply. After the deductible has been met, the patient will be responsible for 20% of the approved amount. For the initial year, a beneficiary may receive up to 10 hours of initial training within a continuous 12-month period. During subsequent years, Medicare covers up to 2 years of follow-up training. I'll discuss initial and follow-up training a little more in just a minute. Now, training should be provided by a certified provider or entity. So you may be asking, what is a certified provider? It is a person or entity that meets the current national standards for diabetes self-management education and support, and is accredited through a CMS certified accrediting organization. I have provided a link to the Center for Disease Control's Diabetes Self-Management Education and Support tool. So there you will find 6 standards that is used by the American Diabetes Association and the Association of Diabetes Care and Education Specialists when evaluating services. On this webpage, you can also find a link for participating in the program. A person or team will need to complete all of the steps to become accredited, which include a formal application process, including supporting documentation. There is an application fee and a reaccreditation every 4 years. And an audit of existing services will be conducted to ensure compliance with requirements. A person or team that completes accreditation can include registered dietitians, nutrition professionals, registered nurses, pharmacists, and other professionals trained in diabetes care and education. Now, services may be provided through telehealth. Um, this does include all locations through September 30th of this year. This is when most telehealth services revert to pre-pandemic rules, and patients will be required to be physically present in designated healthcare facilities in rural areas. Healthcare professionals act as a distant site practitioner. This includes registered dietitians, nutrition professionals, physicians, nurse practitioners, physician's assistants, and clinical nurse specialists. Now, if you choose to provide these services via telehealth, I urge you to look at the MLN fact sheet, provider information on Medicare diabetes self-management training. A link can be found in the resource slides. There's also in the Medicare Claims Processing Manual, Chapter 12, Section 190.3.6. It's titled Payment for Diabetes Self-Management Training as a Telehealth Service. So that would be somewhere, if this is something that you want to do, that particular manual section can provide guidance for you. Now, I will show you the requirements that are listed in the fact sheet. It was recently updated to clarify that distant sites practitioners may bill and get paid for services when done so on behalf of others who personally provide the services as part of the diabetes self-management training entity and provide injection training for insulin-dependent patients using interactive telecommunication technology, which is included in the patient's care plan. I'll show you that resource later where you can find that information just for clarification. Also, they do note that insulin injection training should align with clinical standards, guidelines, and best practices. So when we're coding for the diabetes self-management training, individual sessions are billed using code G0108. This is for 30-minute increments, and G0109 is used to report group sessions that contain 2 or more individuals, and this is also for 30-minute increments. Part B providers who bill on the CMS 1500 or 837P would bill type of service code 1. On this slide, I have also listed the applicable type of bills if you're billing through FIS. If the beneficiary is in a skilled Part A, skilled nursing facility stay, the SNF consolidated billing provision does allow for separate Part B payment for training services. So SNFs should submit these services on a 22X type of bill. Diabetes self-management training and medical nutrition therapy cannot be billed on the same for the same patient on the same date of service or incident to professional services. So when billing for the initial training, the beneficiary should not have received any previous services under codes G0108 or G0109. Services should be received within a continuous 12-month period and should not exceed 10 hours. Sessions should last a minimum of 30 minutes. Beneficiaries usually receive 1 hour of individual training, which can be used for insulin training. And the remaining is usually group. Any units that exceed 10 hours will receive common working file edits. A follow-up training consists of no more than 2 hours of individual or group training per year. Group training would include 2 to 20 individuals, and all of those individuals do not need to be Medicare beneficiaries. This schedule is based on a 12-month calendar year, and it begins after the initial 10 hours has been completed. Training sessions should last at least 30 minutes. Medical records should note that the beneficiary is a diabetic, and any units exceeding the 2 hours will receive a common working file edit. Now, there may be situations where a Medicare beneficiary requires individual training beyond the 1 or 2 hours mentioned previously. Conditions for coverage for this situation are going to be when no group sessions are available within 2 months of the date that training is ordered. The beneficiary may have special needs that would make it difficult to participate in a group training session. So this can include conditions such as severe vision impairment, hearing loss, or language limitations. Now, these conditions should be identified by the treating physician or practitioner, and they should be documented in the patient's medical records. Individual training may also be necessary if additional insulin training has been ordered. If any of these conditions exist, the need for additional or individual training should be identified in the referral. Now, let's talk about when these services are received at a federally qualified health center or a rural health clinic. Payment can be made for FQHCs that bill under the all-inclusive rate, and this payment can be in addition to another qualified visit on the same date of service. So to qualify as a separate payment, the services must be provided as a one-on-one face-to-face encounter. The service should be billed on type of bill 77X with code G0108 and the appropriate site of service revenue code. Now, if you are an FQHC that is under the prospective payment system, then the diabetes self-management training services are qualified visits when billed using codes G0466 or G0467. Under the PPS system, the service does not qualify for a separate payment. Now, if you are a rural health clinic, unfortunately, these services are not paid separately. Next, we'll move on to medical nutrition therapy. Medical nutrition therapy works on treating chronic conditions with a nutrition plan provided by a registered dietitian or a nutrition professional. These services are covered under Part B for patients who receive a referral from a physician and have been diagnosed with diabetes, renal disease, or have had a kidney transplant within the last 36 months. Services should be provided by a registered dietitian or nutrition professional. These services would not be covered for patients who are receiving maintenance dialysis. Services are provided at no cost for patients who qualify. 3 hours of counseling are covered for the first year. This would consist of the initial visit for assessment, follow-up visits for intervention, and reassessment as necessary. Subsequent year coverage would equal 2 hours. Now, when coding claims, 97802 would be used for the initial assessment and intervention and is used only once for the assessment of a new patient. Code 97803 would be used for any reassessments and interventions after that initial visit. This code would also be used if there is a change in the patient's condition that affects their nutritional status. 97804 is for initial and subsequent group sessions of at least 30 minutes. Now, the two G codes that you see listed here should be used when additional hours for medical nutrition therapy services are needed beyond the typical 3 hours for the initial year or the 2 hours for subsequent years. This can occur when the physician finds that there's a change in the patient's diagnosis or medical condition, and additional adjustments need to take place on the nutrition plan. G0270 is used for individual face-to-face services, while the G0271 is for patients participating in group therapy sessions. Services can be billed on a UB04 or 837I if they are performed in an outpatient hospital setting. This can only occur if the registered dietitian or nutritionist reassigns their benefits to the hospital. I've listed the applicable types of bills here. Now, if the hospital does not receive reassignment, the nutritionist or registered dietitian would need to bill Part B using their personal provider number, or the hospital would have to bill the Medicare Part B map. Patients may receive medical nutrition therapy along with diabetes self-management training as long as they are not received on the same day. So again, we want to take a look at FQHCs and RHCs. Medical nutrition therapy follows the same billing and payment guidelines as the diabetes self-management training. Payment can be made for FQHCs that bill under the all-inclusive rate, and this payment can be in addition to another qualified service on the same date of service. To qualify as a separate payment, the service must be provided as one-to-one, face-to-face in-a-counter. The service should be billed on type of bill 77X with codes 97802, 97803, or G0270 and the appropriate site of service revenue code. If you are an FQHC under the prospective payment system, the medical nutrition therapy services are qualified visits when billed using G0446 or G0467. Under the PPS system, the services do not qualify for a separate payment. And again, rural healthcare clinics, these services are not separately payable. Now, the Medicare Diabetes Prevention Program is a behavior change intervention program for beneficiaries who have been diagnosed as pre-diabetic. The goal of this program is to prevent individuals from progressing to type 2 diabetes. The Medicare Diabetes Prevention Program is covered under Medicare Part B for patients who meet all of the following requirements. They must have a body mass index of at least 25 at the first session. They must meet one of the 3 blood test requirements that are listed here within the 12 months before attending the first session. No previous diagnosis of diabetes prior to their first core session. An exception would be someone who had been diagnosed with gestational diabetes. The Benny should not have end-stage renal disease diagnosis or had any previous Medicare Diabetes Prevention Program services. Qualifying beneficiaries pay nothing out of pocket. Patients who meet the coverage criteria can participate in the Medicare Diabetes Prevention Program sessions for up to 1 year, regardless of attendance or weight loss. The program can include up to 22 sessions. Months 1 through 6 consist of 16 weekly sessions, at least 1 week apart. Months 7 through 12 consist of monthly sessions, at least 1 month apart. So here are the list of codes that are used to bill for services. G9886 and G9887 are for the actual counseling sessions, while the remaining codes deal with weight loss. Modifier 76 can be used on code G9886 or G9887 to indicate that a makeup session was held on the same day as a regularly scheduled counseling session. Now, a maximum of one makeup session can be held on the same day as a regularly scheduled session. It is important to note that when you are billing for Medicare Diabetes Prevention Program services, the claim should not include other charges. There are some documentation requirements when it comes to billing for these services. For the first session, documentation should include organizational information such as the MDPP supplier name, the CDC DPRP number, and the MPI. A CDC DPRP is a Diabetes Prevention Recognition Program number that is issued by the Center for Disease Control. It recognizes organizations that deliver diabetes prevention programs according to evidence-based standards that are outlined by the CDC. On the resource slide, there is a link for an MLN booklet. It's titled Medicare Diabetes Prevention Program Extended Model, and that does give information about obtaining a CDC recognition and many other links, including the one for the DPRP application. The provider's MPI should also be included in the supplier information. We will take a look at that resource later, just so you can kind of see what it looks like, and there are just a ton of links in there for you guys. For the beneficiary, basic information should be included. At a minimum, this would be the beneficiary's name, MBI, and age. Lastly, you'll want to include evidence that the patient meets the eligibility requirements that were listed on slide 31. For additional sessions, documentation should include the type of session. Was it a regularly scheduled one or a makeup session? Was it in-person or distance learning? And the MPI of the coach who furnished the session, along with the date and place of service. You'll want to also include the curriculum topic. The CDC's Prevent T2 curriculum has sessions. It includes a wide range of topics to help individuals get more active, learn how to shop and cook healthy meals, manage stress, and get enough sleep. Additional information to include in your documentation would be the patient's weight and the date it was taken. So let's talk about eligibility. I want to talk about that a little bit just so that you guys can kind of avoid any denials that you may get for frequency. Now, you do have a few options when it comes to checking patient eligibility. We have the WPS SecureNet Access Portal. It's often referred to as the portal. Users must be registered with WPS to view a beneficiary's eligibility information. When you visit the WPS website, there is a box that takes up most of the screen, and this is where you can either register or you can log in if you already have an account. Direct data entry, or DDE, is an option for providers who bill using the Fiscal Intermediary Standard System, or FIS. This also requires you to register with WPS. Users will have access to Common Working File, which provides eligibility information for Medicare beneficiaries. The HIPAA Eligibility Transaction System, or HETS, is available for both Part A and Part B providers, and it provides access to eligibility data in a real-time environment. This option does involve submitting files via electronic data interchange, so a trading partner agreement is required. Response files are accurate at the time of transaction and should not be interpreted as a guarantee of payment. I did want to show you, if you do get access to the portal or if you already have it, there is a preventive services tab for a beneficiary, and it will list like all the preventive services that have frequency edits, and it provides kind of like the information you see here. You can see the procedure code. If a modifier was applied to it, it'll give you the next eligibility date, and it's going to include the deductible amount, deductible remaining, or coinsurance amount. So this is what it would look like if you were to use the portal. So I have provided you with a list of resources that I thought would be helpful if you were looking for additional information. I do have some of them pulled up. Here we have the Medicare Diabetes Prevention Program expanded model. You can see there were a lot of updates done to this. And I just want to scroll down to show you where some of this information is. I apologize if that bothers you. Here you can see where it talks about the MDPP services. There were a lot of updates made to this information. It talks about patient eligibility. Here's where it talks about suppliers, getting CDC recognition, Medicare enrollment. Gives you information on coaches, payment. So there really is a lot of data. That's why I wanted to provide it to you guys, because I don't know specifically what you could be looking for. So I want you to know that there is a place where you can get more answers. We also have provider information on Medicare diabetes self-management training. This one gives you information on who can provide diabetes self-management training. Here's where it talks about telehealth services, being a distant site practitioner. Here's the information that we talked about, applying to be an accredited organization. Lots of links in here. Currently, CMS does have two approved accredited organizations. That's the American Diabetes Association and the Association of Diabetes Care and Education Specialists. Again, just a lot of information that you can get in here. One of the tools that I wanted to show you guys that I think is helpful regardless of what preventive service you're billing for. This has all of them listed out. The T on these means that they are telehealth eligible services, but you can click on whatever service you're looking for. It gives you the codes. It gives you if there's a required diagnosis code, coverage information, frequency. It gives other notes. Now here's what I was talking about, where there are spots where it still brings up the TS modifier. But since CMS has changed their guidelines and said that diabetes screening services can be billed twice within a 12-month period, they don't require that anymore. That was something that was used for pre-diabetics. I'm sorry, the diabetes self-management training. It gives you a link to the NCD, so you can look there for coverage. Here, there are a lot of other notes, and it does give you links for further information on that. So I just find this a very helpful tool, regardless of what services you're looking for. The last one I did want to show you was this was the telehealth FAQ. That's that last link on the resource slide. And the reason that I did want to show you this is because it talks about diabetes self-management training and medical nutrition therapy services being furnished remotely by hospital staff. So down here, I won't read all of this to you, but it does say that through September 30th of 2025, hospitals can continue to bill for these services when furnished remotely by hospital staff to beneficiaries in their home. So I just wanted to provide that since that was something that's still eligible right now, but is going to change on September 30th. Okay, let me go back. Now, before I check in with Leanne to see if we have any questions that have come through in the chat, I did want to answer some pre-submitted questions that were received during registration. The first question was, does the training have to be done by a certified trainer? I'm going to assume that this question is in regards to the diabetes self-management training. Yes, training does have to be done by a certified trainer that meets current national standards for diabetes self-management education and support, and that is credited through a CMS certified accrediting organization. CMS has approved the American Diabetes Association and the Association of Diabetes Care and Education Specialists as accrediting organizations. So in that training, let's see, I'm sorry, just one moment. I think if we go to page 5, here it has the standards. So there's some information there. And there's also, I'm sorry, I'm having problems finding it now. Is that the one I'm looking for? Okay, I don't want to make you guys wait, but there also is a link that will take you to the Center for Disease Control. There we go, for the application. So that would be where you would be able to find that information. And hopefully that was helpful to the person that asked that question. I also got a couple questions that asked how to code chronic kidney disease with diabetes and how to code chronic kidney disease with diabetes that is also associated with hypertension. Now, unfortunately, I can't really provide an answer to these questions. There's no mention of what services are being provided, so I'm not sure if the question is related to specific services that require a specific diagnosis. Also, I am not a certified coder, so I am not qualified to tell a provider how to code their claim. This information would need to come from somebody within the organization who has access to the patient's medical records and can translate the healthcare provider's diagnosis to the appropriate ICD-10 code. If that's not what those questions were asking, then please just provide more information and I can see what I can find for you. With that being said, I will turn it over to Leanne to see if we've had any questions come through in the chat.
Karen, we do have a couple of questions in the chat. And the first question is, what is the purpose or indication for follow-up DSMT training?
What is the purpose? I'm sorry. Can you read that to me again?
Nope, that is okay. What is the purpose or indication for follow-up DSMT training? So I think they're looking for the reason why that might occur.
Okay, let me get to that. I'm sorry, I'm going to make sure I'm in the right one. I'm sorry, I thought the information was in here. Diabetes, it could be follow-up if the patient has not met goals during that initial time, then there may need to be some follow-up training. There may be a change in the patient's condition, maybe nutritional needs, things like that. So there could be multiple things that could affect the patient having to maybe learn new tasks or adjust those tasks based on the care plan.
Okay, and the next question is, after a patient is diagnosed with diabetes, what is the A1C testing frequency?
The A1C testing frequency would be the same as the diabetes. It falls under the diabetes screening test, so it's still those 2 tests within a 12-month period of time. It all falls under that.
Okay, and Karen, those are the only questions we currently have in the chat.
Okay. Thank you so much, Leanne. Well, after the close of today's webinar, you should receive a thank you for attending email. There are 2 sections that I would like to call your attention to. The first section is titled Your Opinion Matters. This is where you will be given an opportunity to provide feedback if you have not done so already after this closes out. The second section, titled Certificate of Achievement, gives you proof of attendance and contact hours that can be submitted to your accrediting organization for continuing education units. Now, if you do not get this email, please check your spam or your junk folder. You will also need to add messenger@webex.com to your safe sender list to avoid issues in the future. If you join by phone, you will not receive this email. In those cases, please send an email to the education mailbox with your name and the phone number that you used to join, and that way a certificate can be sent to you. Now, if you think of any follow-up questions after the webinar, you do have 7 days to send those in. You can email those to the education mailbox shown here on the screen. Be sure to put today's topic in the subject line so that staff will know that your question is related to this webinar, and they'll send it directly to me. Now remember, if it is claim specific, those should go to customer service. When you disconnect from the webinar, you will be redirected to a CMS survey. I'm also having Leanne add a link in the chat. And your feedback really does mean a lot to us. We review what you have to say, and we do our best to make the changes that you asked for. This is also an opportunity for you to let us know what topics you'd like to see us provide education on in the future. So if you have something specific, please add that. Also, if you have any ideas that you think would improve how you receive your education, be sure to tell us that too. We'd love to hear it. The redirect does look like what you see here at the bottom of the screen. We don't have any control over how this appears, so we just want you to know that this isn't anything malicious. It's not spam. It is the CMS survey. Now, we have made some recent changes based on survey comments that we want you to know about. Chapters have been added to our encore presentations in YouTube. These timestamps can be found in the description, and they break the webinar into different sections or topics of discussion. Not only does this give you an overview of what's being covered, but it allows you to jump to points of the video that interest you. It also allows viewers to easily rewatch sections of the video. Training indicators were recently added to the description of our webinars to help you decide if the material applies to you. Although that you can usually tell from the title, training indicators will let you know if the material being covered is clinical, billing related, whether it pertains to Part A or Part B benefits, or which billing system will be discussed. I know that in the past, a title might mention Part B, but the material covered was outpatient hospital services. So now the FIS training indicator can be added to make it clear that what information is being presented. Now, one that is not on here, but is due to survey comments, on July 15th, we are going to hold a Medicare Education Expo. This is going to be an all-day event with multiple webinars that are being held throughout the day. The topic will be local coverage determinations. This is something that has been suggested as a future education topic on many surveys. There is a link on our live events page, and it's going to take you to a list of all the webinars being held that day. So you can register for one, you can register for multiple events. It's been quite a while since WPS has done an all-day event, so we hope it's something that the provider community will enjoy and something that we can continue doing in the future. Well, this brings us to the end of today's presentation. On behalf of myself, Leanne, and the Provider Outreach and Education team, I'd like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.